Okay, good morning. Welcome to the Board of Health special meeting. It's 8 o'clock. We'll call this meeting to order. Today is a kind of a special meeting where we're basically just doing interviews, so we have no minutes to go over. The board remembers that we had at the last meeting, we had 3 new members that were sworn in. But since we've spoken with that was done the same process as the BOCC does with most advisory boards. However, the legal team has told us that we need to do a do-over. So basically that's what we're doing today, doing a do-over today. And next week, there's another interview with some more members. Furthermore, the tribal member, Alyssa Fine, who was with us up until the last meeting, she has resigned and she's moving on to a job position, she told me. So today is just the first of 2 meetings, just for dealing with the interviews. We have 3 people, candidates that we're going to interview today. After the 2 interview meetings, the Board of Health will then take a vote on a recommendation of the 3 positions, the 3 candidates for 3 positions. That recommendation goes to the Board of Commissioners, and the Board of County Commissioners, not the Board of Health, would actually make the decision and their vote and the final appointments for the board. A standard set of questions was developed between the legal team and our clerk's office that was based on the WACs and RCWs. These questions were used on the applications. I don't know if I need to read through each question. No, but they are standard and they are on all the applications. The board can follow up with any other questions after that for each candidate.
I did get a question from a person over the weekend. Are these available to the public too? So they are on the website. Okay. Okay. All right. Thanks.
Okay. Anybody else have any comments before we start with the first candidate? All right, we'll jump right into it. Our first candidate for the Board of Health to the other stakeholders, other community stakeholders, is Lorna Stewart. Thank you for joining us this early morning.
Thank you. Thank you for having an alternate day that we could sign up for.
No problem. We try to accommodate. What did you think of the application process? How's that first question?
Oh, it was pretty straightforward, just on the website and fill out the questions and send it in. So very, very easy.
Okay,
Yeah.
That's good. Well, I guess the interview process is kind of open. Just start with whoever has first questions or would like to ask a question. Mary Jane?
Did we not get questions?
The
I thought there was a prescribed list of questions.
Those are the ones that are on the application.
Oh, these same questions here?
So
Go ahead.
while you look at it, you mentioned in your application that you've done a lot of volunteering and in particular, the sentence I'm looking at is these diverse populations are all represented in Cowlitz County, and I have shown success in working with all these groups. Could you provide me an example?
An example of success?
And maybe if you have a failure too.
Yeah, so depending on which group, I guess you're talking about, success might be measured differently. In fact, I worked for 4.5 years with homeless youth and women involved in prostitution in the Seattle area. And success there sometimes is picking up a young lady on the side of the street and taking her out to coffee. So she's out of the rain and out of the out of the weather for a while and developing a relationship with her. It may not be she leaves that life at that moment, but or that lifestyle, but I would call that a success to build that relationship with her. On a more local level, more recently, I served for 7 years on the Calatu Soccer Association Executive Board. And I think one success we had there was during COVID, we were very innovative in still getting kids out on the soccer field. There were a lot of parameters that we had to keep in mind, some hoops we had to jump through, but we were still able to, we provided what we called Soccer Saturdays, where we had kids come in. We had, I think, 8 or 9 weeks that they could come and play, and we were able to follow the guidelines that we were given and still get kids out on the field and interacting with each other. So there's a couple successes
thank
maybe.
you.
So you talk about, one of the questions is describe your.
It's hard to, I can't hear you.
I'm a little slow.
That's okay.
Describe your commitment to public health. Can you talk about your commitment to public health? And also, can you tell me what your vision or what your definition of public health is?
Yeah, so my commitment to public health, I think first of all, it's been obvious. I've been at the meetings in the last number of years and tried to give input when I'm able. As far as my commitment to it, I think being involved in youth sports is one good measure of commitment. I mean, the kids need to be out. It's good for their physical health, their mental health, socially, all aspects of their life. So I was involved in that, like I said, for 7 years. My definition of public health, how to define it without using the term, right? I mean, it's the health of the local, whatever jurisdiction you're talking about. I think public health in this term of how the public is interacting with the government in regulations and guidelines that the government is giving that impact public health. You had something else. Did you say the vision? Wait, what was else? I'm sorry, I lost.
No, just your definition and your background in public health.
Okay, I hope I answered that.
Good morning. I now
Good
have a
morning.
name. I didn't know your name before this.
Oh,
You know, we never have people introduce themselves.
you
and,
know, I know. Well, now you have it.
You mentioned that you represent the business community,
Mhm.
but you don't list, you list that you have no connections with any business organizations at all on the back page. You have no other organizations that you're dealing with. So help us understand the local business experience that you have to represent
Yeah.
that type of a community stakeholder.
Yeah, I think that kind of to talk about the last page, when I answered that question, my interpretation of that question was businesses that impact public health. And so when I said no to that question, it was, I don't have a financial stake in any business that a regulation would be made from this board. So that was my interpretation of that question. As far as business owner, we own rentals. So that's my connection to the business world locally. Yeah, so that's our business. I'm not sure how much more you want besides that.
That's fine.
Is that good? Okay.
That's information that wasn't on
Yeah.
there. And you have attended a number of the public health meetings. To what extent should the Board of Health be making recommendations to the Board of Commissioners in terms of how we identify what the major priorities are for protecting public health?
Right. So to what extent should they be making? Not totally sure if I understand that. Like, I think the Board of Health should.
Actually, let me just rephrase.
Okay.
What are your priorities
Okay,
for
that's-
public health?
That's a good question. Okay. I think my highest public health priority right now is drug use and mental health as it impacts, especially the homeless population. I think that's a huge public health issue in this county. Maybe it's a little side note. The Longview Police did a presentation to the Longview City Council a couple of months ago. I can't remember if it was a regular meeting or maybe a special meeting. And I walked away for the first time really encouraged. I've been frustrated with the response to homelessness in this area. And I walked away really encouraged from that meeting. And so I would love to somehow have the Board of Health and the county be supporting the new direction that the Longview Police is going with their homeless response and how they're providing interventions for the homeless. So I think that's probably the biggest priority that I would say.
Thank you.
Yeah.
Following up on that question, the drug use, I believe also a big problem. I have been of the mind to educate and prevent children from doing it in the first place as a key to prevention of the future users. What do you think about focusing on that?
I think there's a piece that needs to be focused on that. I'm not totally sure what that should look like, to be honest. We had Joy Lyons from the ESD came and made that presentation. I don't remember if that was April or May or something. And I've followed up with them and asked them for their statistics, comparing kids that have gone through their program and kids that haven't gone through their program. And I think we're on like 7 or 8 emails now, and they've forwarded me to a number of people. I still haven't gotten really like solid data from them that says, wow, the kids in our program do X and the kids who haven't gone our program do Y, and this is the difference we're making. So I would love to see some like really solid data on that. I think there does need to be an education piece. You know, she herself said that the, what program did she mention? The This Is Your Brain on Drugs program. She said that actually ended up being more harmful than helpful. So I just want to make sure that whatever we're doing doesn't end up being more harmful than helpful. I mean, maybe what they're doing now is more harmful than helpful. I just don't know. The numbers just aren't there. So I do think education needs to be a part of it. I'm not sure what that looks like, to be honest. You know, do we give parents that, you know, do we enable parents to educate? I mean, that's going to be the strongest advocate for any child is their parent and their family. Do we somehow strengthen families that, you know, give kids that support to not fall into that? I'm not totally sure what that looks like. But I'm willing to look into it more, but I was really hoping at one point in the emails that we sent back and forth, I said, I really want to be able to like say, this is a great program. Like, can you guys help me? And I haven't gotten that back yet. So anyway.
I appreciate your interest in just following up with Joy.
Yeah.
Because yes, there was a lot of questions, and that's so far this board has only seen that one group, their efforts.
Yeah. And I'll forward that to you. I was going to do that. They just, maybe it's been a week ago, sent me like a packet of, it was like an attachment to an email, a packet. And I haven't really even looked at it, honestly, thoroughly. I've super quickly perused it, but I'll forward to that so that the whole Board of Health can have it. I think that'd be useful for everybody to have.
Thank you.
Yeah.
Commissioner Dahl?
Yeah, I'll probably follow a little bit up on Dennis. Kind of get your ideas on what do you think the end product should be from the Board of Health? Is it programs that we all follow? Is it information and resources? Or is it some kind of combination? Where's the happy medium there?
Yeah, that's a good question. I would probably lean more towards information and resources. I think people need to be able to make their own decisions regarding their health, along with their physicians and their medical team. I think that needs to be the main decision-making body for an individual. There are some program types, like I said, if we can somehow support the, the homeless task force, or we can somehow support, the new direction that Longview Police is going, maybe that would look more program-ish. But I think as far as individuals, I think it needs to be, I don't think there should be mandates coming down. I don't think there should be things like that. I think it needs to be, here's the information, you take the information, go to your healthcare team, and together, that's where the decisions need to be made on personal health. Any further questions from the board?
A question, can you talk about what you're, what you view as the difference between personal health, like you going to your medical team and making a decision versus public health?
Yeah, so public health to me, I guess, like I was saying in the beginning, when you asked a definition of public health, is more policy wise as a governing body. So for instance, putting out information, putting out, you should wash your hands before you know, as a restaurant cook or whatever, those type of things versus personal health is things that just impact you as the person, like you need this medication. I'm not gonna, it shouldn't be mandated that you take this, you know, you take blood pressure medication so you don't have a stroke while you're driving. That shouldn't be mandated, but you and your physician need to make that decision. Okay, I need blood pressure medication because my blood pressure is running high or whatever the situation could be. Did that answer sort of? Okay.
Thank you for that one too.
Most of the stuff, you know, they've done a pretty good job of
Yeah.
answering out in here, so. I think, and we're kind of running, if we're holding to our 20 minutes, we're about there
Okay.
anyways.
Well, thank you very much.
Well, is there a question you would want to ask?
I was
any
gonna
of
ask.
us?
Oh,
It's not necessary, particularly if you intend to ask me a question.
wow. Not that I can think of off the top of my head. I feel like I've been to enough meetings. I have a pretty good sense of how it works. So, yeah, not that I can think of. Thank you though. So
Well, thank you for
Perfect.
your time.
absolutely. And
Thank
thank
you.
you. Thank you again.
Enjoy your trip. Be safe.
Thank you. We will. It'll be fun.
The next person we have, but I don't see this person here yet.
We got a couple minutes probably, but
Yeah, we got a couple minutes. Should we take a quick break?
we can.
How about
You can just recess it till the next person gets in.
yeah, okay, we'll take a short recess until the next candidate comes in. Okay, we're back at the Board of Health again, and we have our next candidate, Karen Joyner. Thank you for coming. We'll start again at the end, I suppose. Commissioner Mortensen?
It's not necessary. We could do a shift by one and
Happy to go. Welcome and thank you for coming. Thank you for applying. Can you talk a little bit about in your application, you talk about page, your commitment to public health. Can you talk about the difference between public health and personal health and what your definition of public health is and how it might relate to our community?
Certainly. My background in nursing gives me some extensive experience with the difference between public health and personal health. Public health being looking at society and what's out there and what we can do to better society's health as a whole. So public health is concerned with sanitation, clean water, diseases that are infectious that might affect the public. Versus personal health is more about how am I doing? How is my health? When you look at public health, you think about access to healthcare. What does the general populace have and need to maintain their health and encourage their health? Maybe it's education. There's an overlap between public health and personal health in that I, as a person, need to know what's going to help my health, but so does society in general. An example I can give is when COVID hit, and I was at the college in a dean position, and the meeting with everybody. We had a big meeting. I was running the meeting. I was serving as interim vice president of instruction. And what do we do in this big news, right? And at that point, what I chose to focus on in the meeting is, hey, this is new, this is scary, we don't know, but we can all practice good hygiene. And talked about hand hygiene. Wash your hands, be aware of where your hands are. Look around the room, how many of us are doing this? And so that was a great intermix of personal health and public health. You're welcome.
You mentioned in your application that you were raised in Montana. Whereabouts in Montana?
Missoula. Of
In
course,
Missoula.
the joke is if you go 50 miles out of Missoula, you're in Montana.
Yeah. Yeah, Missoula is a pretty big city. I just spent some vacation time in Big Fork, enjoying the musicals. So you've lived in this community for a while, obviously, and you've interacted with future nurses, obviously, in the community. Oh, how would you define your priorities for addressing public health needs in this community? What are they?
So I think public health needs always start, I like to go back to Maslow's hierarchy of needs. And, if you look at the bottom of his hierarchy, it's always about physiological, right? Food, water, sanitation. So we need to make sure we have those things, that base covered. Then we look up to the next level of safety and security. So I see public health needs for our community are addressing some of those basic, what's access to food, what's access to sanitation, how about our clean water, how about our basics? Do we have those covered and covered well? Then let's look to safety and security. Let's look at access to healthcare. Let's look at health disparities so that we can make sure that we are taking care of our most vulnerable members in our public area. So that's how I look at public health.
Okay,
Make sure those basics are covered.
thanks.
I don't have a specific question right this second. Commissioner Dahl?
Probably just, what I would ask is, same thing I asked the others is, what do you see as the end product of, what do you think the end product of the Board of Health is? Is it programs? Is it information? Is it a combination? What do you think the end product should be?
Ooh, excellent question. I think the end product, and first of all, I want to say, it was very hard for me in doing some prep for the meeting to find what the goals were
Yeah.
of this. I couldn't find them on the website. I tried a million different ways. So that's an excellent question. I think the end product of public health is ensuring public health. So to me, that means a lot of providing for the basics, making sure we have those basics met. It's education. It's not about control. It's more about ensuring that people have good, healthy choices and infrastructure in place.
Do you have any time commitments or anything that would prevent you? We have monthly meetings, usually at 10 o'clock on the last Tuesday. Any kind of conflicts with
No.
that?
I
No?
can make myself available for that. On Tuesday mornings, many times I'm serving on a discipline committee for the state board, the nursing board, but that is flexible.
And are you okay to criticism? Because being on the board here, we get criticized quite a bit.
Well, serving as a dean and director of a nursing program, I am open and used to that.
Very good.
We did have YouTube can't put us in timeout for a
Yeah.
while.
YouTube jail.
Cracked me up.
So Karen, I really appreciate you applied.
Thank you.
I feel I could talk to you for hours, so I'll try to be very constrained here. The question that my colleague immediately to my left asked between public health and personal health is one that it's certainly one. The public health often will fall into trying to decide when my disease affects you, the general public. And I like the answer you gave, and I think we need to keep that in mind when we decide. So as a I've got to stop and make sure I'm asking a reasonable question. Tell me a little bit about your recollections of when opioids first became understood to be addictive.
Oh my, that's a great question. Having served in healthcare as a nurse practitioner since 1996, recently retired, it's been very interesting to watch the pendulum swing as far as pain control and how we control pain and what the problems are. I would say that we've always known there's a risk, always. I think it became more pronounced in probably the early 2000s. And that's where we were prescribing because we were trying so hard to treat pain. Pain was the sixth vital sign. You had to assess that on everybody. You had to make sure you treated it adequately. I also had experience in hospice where pain control is absolutely number one. So I think the pendulum, we got a little too overzealous in our prescribing.
Who's
And
we?
We meaning healthcare providers, and didn't realize the severe impact that was going to have. I did not realize the extensive marketing that was going on with OxyContin. You don't realize that when you're a healthcare provider because you see it as they're telling you this is the good thing, this is what you're supposed to do. And so it was about 2000 that I think we started having more awareness. 2010, that decade. I think it's been most pronounced since about 2018. And I believe that addiction, not just opioids, but alcohol addiction, all addiction issues are a number one public health concern. When we look at public health as managing the health of the population, and that is a huge effect on our population right now, particularly in the rural areas. Having been involved with many rural areas in Washington State through the Rural Outreach and Nursing Education Program that I helped get up and going from Lower Columbia College, I've been to Ferry County and saw firsthand that addiction was their number one issue, and that was alcohol. So addiction's huge. I hope that answered your question.
It did as best as I think anybody could. Like what I'm thinking right now is laudanum was known to be addictive back in the early 1900s. Alcohol has been known to be a problem since forever. And so whenever I see a discontinuity in history, I wonder exactly what stimulated this thing. It's beyond me some of the conclusions that OxyContin was less addictive than other stuff, and that's been used as an excuse, and we've penalized pharma. They've got plenty of blame. So your thoughts about the FDA, which came about, what, about 1953-ish?
Ooh, that's a very general question. Thoughts about the FDA? Can you refine that a little bit? Is there something specific?
There are treatments that are available in other countries that take a long time to be available here. And the question is when you're treating a patient who's maybe having real troubles and there's a potential cure that the FDA doesn't want you to use, that kind of thing.
You know, that's very difficult because I very much believe in evidence-based practice. And so we have to look at the evidence, and evidence can come in all directions and you can have dirty data. So there's a lot to look at. Sometimes I think the FDA is overprotective on what they're going to allow in the states. I would say overprotective versus underprotective, because often there are treatments available in European countries that are not available here. I trust most European countries to have vetted what they are doing well. So I think sometimes the FDA is a little tight, but I understand that their job is, again, public health and to protect the populace. So they don't want to approve something that they are not sure of is safe.
Karen, you mentioned the pandemic, I think, as it having had an impact as you were finishing up your career, I think.
Yes.
What lessons have been learned from
Ooh.
going through that whole experience? We don't have too many of those pandemics.
No,
So,
no.
It's a learning opportunity, and so what have we learned about?
I think that's an excellent question. It'd be wonderful to sit here and talk about that with you guys for a while. I think some of the important lessons are we didn't know what we were dealing with. And we have learned from that shutting down everything, shutting down the world and society caused irreparable harm to economy, to mental health, to education. There was just a lot of damage. We have also learned that our healthcare system can be overwhelmed pretty readily. And we learned how to mobilize additional resources when needed and where needed. Having seen some of the hospitals be overwhelmed, it was frightening, very frightening. I think some of the other lessons are how much should government intervene in individual health versus public health, and where are those lines? For example, I know that you guys instituted that, I'm sorry, I'm not going to get it named, right, that the special document about
Medical freedom resolution.
Yes, thank you. Thank you. And I think that was a lesson learned. You know, how much can we be imposed on us, what we should put in or on our bodies versus how much is freedom? I think that a lesson learned was basics, hand washing, cleanliness, keeping distance from people, covering your cough. If you travel to Japan, for example, you will see people wearing masks all the time. That's just an accepted cultural norm there, that they wear a mask. And you don't know if they have a mask on because they're contagious or they're protecting themselves. Fabulous. So I think that was another lesson learned here, is that we need to allow our cultural norms to shift. If you want to wear a mask, wear a mask.
Thank you.
Any further questions? Okay.
Is she going to ask us?
Yeah, would you like to ask? Do you have any questions for us? Thank you, Dennis.
I do. Thank you. What are your priorities for public health as a board?
Well, it's an agenda topic. We are meeting with the HHS at the next regular meeting to kind of refine the priorities. If people would like to tell their individual priorities.
Yeah, if you look at the data, we spend more on public health than any other nation in the world, and we're not the number one in public health. Of course, those measures are a bit soft, but the dollars being spent and the slope of our success is not this way, it's this way. And so the question is always on my mind, are we part of the solution or are we actually part of the problem? You used the term evidence-based before, and I have a very strong science background and engineering, and I find it appalling what people call evidence. So I would like us to make more judicious decisions how we spend the money. And that requires a lot of data, and it's the devil to get real data.
Thank you.
Real quick, it feels to me like we're just ordinary citizens. We're not experts. And so I tend to have confidence in our Board of Health staff, because those are the folks who are on the front lines. Those are the folks who are answering the phone calls and collaborating with the local care providers. And so I believe that they have a good read on what our community needs in terms of public health.
There's an interesting relationship between the state government and the state health boards and HCA and all that, and what we do at the local level. the state has their interesting formula on how much money is available for public health remedies, programs, treatments, whatever. We send hundreds of thousands of dollars back because we don't spend it. And part of that is we've never done a systematic data collection query in terms of what are the real health needs. We're really good at reading headlines. That doesn't necessarily identify the local health concerns. So we're operating at kind of an absence of data. I always get a little nervous when people say we need to use evidence-based practices because one size does not fit all. And what may be the evidence-based successes in downtown Seattle simply isn't apropos here in a much more rural setting. And so there's that, we need to have the information gathered locally, I think.
I agree, because you
and-
need to be able to compare apples and apples.
The result is we send hundreds of thousands of dollars back that the state says is available to us to solve problems. We haven't figured that out. We haven't figured out the problems yet.
But what a fun challenge to have money to
Should be.
spend. You just have to figure out the right, helpful ways to spend that.
My priority has been, well, my idea of a priority would be to focus on the youth. Our Healthy Youth Survey showed, I don't have it in front of me now, but it was close to 80% or something of the youth in Cowlitz County were experiencing some severe mental depression and problems. Then which leads to drugs, which leads to adult drug problems. I think the war on drugs hasn't really done a lot of good. I've spent money since I was a little kid on projects like that. So I think targeting the kids to kind of as prevention, an ounce of prevention is worth a pound of cure is what I was taught. And so that's been my priority, trying to focus on the kids.
Yeah, I'm kind of somewhat along that line. I think you start with the kids and ensuring that they have good basics and they have the information they need to do the healthy things. On the other side, I differ with Commissioner Weber a little bit. I think I don't really need to study what's wrong with our county. I think drugs create a lot of things. It creates homelessness, it creates theft, it creates all kinds of things. So I'd be much more than studying that, getting into some viable things that could actually be done to help it. I don't ever believe you're ever going to cure drug abuse. It's going to be around. It has been forever. But I think we can find a better path than what we're on now. And sometimes those are hard questions, and a lot of times people don't want to get into the hard questions. But I think as a Board of Health, we need to touch those and not be afraid of criticism from outside if we do touch on those hard questions and some of those solutions. So I don't, if we're going to spend money, I want to see a result. And it's very simple that way. I'm not going to take somebody's money and just turn over and not give them anything. If we're going to spend money, I'm in the sense of, I'm in the vein of Commissioner Mortensen. If we're going to spend it, I want some results. And that's what I'm
and I-
looking for.
Yeah, and I think we owe that to the taxpayers. If we're going to spend their money, we
Absolutely.
need to have a result to show them.
Absolutely, yeah.
Thank you. There's a wonderful book on addiction in humans, and it's about addiction throughout the years and kind of biologically how that is set within us. And it's a great look at addiction. It's kind of scary, but
Yeah.
it's a challenge.
You get me on, probably get me going down an aisle we don't need to go, but to me, we've made, if you look at it, two roads, you got the addiction road and you got clean road. We've made the addiction road so easy, there's no reason for somebody to get off that road and come over to the other. And I think we need to square that up.
The question is how, right?
Yep.
Thank you. What do you see as the primary thing that I can give to the board?
Somebody wants to, go ahead.
You've got a background in history for medical treatment, and you are now a teacher at college, and I think you see the youth through the ages, the changes. I'm assuming you've been in the business for at least 3 decades or so,
Mhm.
probably longer, but I don't want to get slapped. And that's the kind of expertise I look for. I look for the background without the bias. And so I think that's what I see in you as the prospect.
So I'd like to, I have to cut us short now because we're running over time. So I'd like to thank you for coming and talking to us today.
Yeah, I very much appreciate your time. Thank you.
Very much appreciated.
Thank you very much for having me. I enjoyed it.
Thank you.
Best wishes.
Thank you very much. Bailey's gonna tell Kelly, yeah, to release another.
You guys gonna release another from the hole?
I'm glad you stopped it.
It's tough to,
Yeah.
listen, focus, ask, be prepared to ask questions and watch the time all at the same time, run the
I
meeting.
am offering the feedback.
Thank you. So the next candidate, I believe, is Michael Phillips. Hello. Are you Michael Phillips?
One and the same.
Okay, welcome. Thank you for coming.
Hey. It's my pleasure.
Sure. The Board of Health is going to ask you a few questions, and we've been starting, you want to start again, Mary Jane? Okay, Commissioner Weber, please.
Yeah. Put Dennis on the hot seat.
Mr. Phillips, thank you for your application.
Thank you.
We have had a very thorough list of applicants, so some interesting perspectives from all throughout the community. So I appreciate the information that you've provided us. I'm most curious as to know what you think the priorities for public health should be in Cowlitz County.
As far as, you mean, the priorities of programs that need to be instituted?
What do you think are the
Okay.
biggest challenges?
Well, I think
for us?
first, the issue of homelessness and figuring out how to address that. That's a very big issue. I know that there's a concern about the increase in illegal drug use and how to deal with that, both in terms of the person that may need treatment and the effect that that has on the rest of society. It's not just the person. There are public health implications on not treating and not taking care of the needs of those people that, they go on to the rest of society. I think also that there needs to be fact-based, science-based programs instituted that will help public health in the larger scheme, as far as vaccinations, as far as measures taken to protect people from other potential injury, things like air pollution and ambient noise and things like that. These are issues that have profound implications for the health of the public at large.
Thank you.
You, in your application, you wrote why you were interested in the position. You said science is not static. As new credible research becomes available, public health policy must adapt. I fully agree. So knowing now that we know that children are the least vulnerable to COVID, would you still have followed the CDC's and the governor's guidelines to shut down the schools for almost 2 years?
I think that you have to follow what the best available information is. When you look around the nation and you see the distribution of where COVID deaths occurred and the procedures that were in place in those and the support that they got, it's incumbent that we be as prudent and as all-encompassing as possible. And when we look around the world, the areas in Africa that did not either have testing or vaccines, they had huge death rates and infection rates. And so I think that I would follow what the CDC recommends. If they have the peer-reviewed evidence that's whatever policy, then I would follow that.
So you would follow whatever the policy is from the CDC?
If it is peer-reviewed and shown to be efficacious.
Okay, thank you. Mr. Dahl?
Kind of thinking that one over a little bit.
If you want a little time, I can go ahead.
Yeah,
So, assuming that somehow you've got the magic and you as a member of the Board of Health can make this one key decision and drive it to success, that is to implement this decision, can you tell me what that would be?
Which decision is that?
That's the one that you're supposed to answer.
Oh,
So you're on the Board of Health and you, by dint of your ability to sway, you swayed the board into a key decision, and I'm asking you what that is.
If I had to make one key decision, I think that it would actually be sort of a combination of things. Reinstituting the drug court I think is very, very important. And I would also advocate for reinstitution of the needle exchange program. If you look at the cost of not reinstituting a needle exchange program, one case of HIV, the drugs cost $1,400 a month. One case of Hep C costs $64,000. One case of necrotizing fasciitis or flesh-eating bacteria can go from $64,000 to $5 million. That's a cost that the public has to pay in one way or another. And so I would advocate for that. And we have seen that the drug court has been, it was supported by all the leadership of law enforcement and the medical community in the county. And I think that for the pittance that it cost, I think that would be, that is money well invested. Just as an aside, we keep hearing that government needs to act more like a business. Well, one of the major causes of business failure is undercapitalization, underfunding. When you underfund public health, people die. Simple as that.
I'll go ahead if that's okay, Kelly. can you describe what your vision of public health is, how you define public health and compare that with personal health?
I think the public health, it has to encompass both education, giving people the knowledge that they need and the programs available, such as the drug court, such as needle exchange, so that they can make the best decision. If people aren't given the education to know what their options are and what the effect of their choices are, that's a disservice. So I think that education and advocacy for vaccination of measles, vaccination of chickenpox. I guess I've seen enough cases of what happens when people don't follow those recommendations and advice. It's pretty dramatic. It's not something that you want your kids to experience.
Mr. Phillips, in your application, we have in your professional experiences that you've worked with partners in careers, and they describe it as a warrior training program. Is that a typo?
Not worrier.
Worker. isn't
Worker.
it? Okay.
Yeah, I'm
yeah,
sorry.
yeah. Okay.
Sorry.
I thought that was
I'm
the
not a
case.
computer
Yeah.
genius.
Couple things, just to my knowledge, drug court's still going and we still have needle exchange. Are you saying we don't?
My understanding is that the commissioners voted against the funding for the drug court, and it will go through, I think, to the end of next year. I believe that that's what the timeline is, and then the funding would end for it. Is that correct?
Well, we voted to sunset a tax.
Right.
Whether drug court gets funded or not, I don't think has anything to do with that tax, but
But
I know
that was,
people think that, but
oh, I guess,
yeah.
that's part of the education, I guess,
Yeah.
of knowing where what funds it, and the information that's been circulated indicated that tax was what was funding the drug court.
Well, it gets part of that tax. Yeah, that part is true, but it doesn't mean it's not going to be funded.
Okay.
I know that seems to be popular opinion out there. In your Calhoun County deserve to have health policies based on best, and you kind of answered best peer-reviewed science, not personal opinion. Do you think we've been operating off of personal opinion?
I think that the decision to do away with the needle exchange, I think that was a personal opinion, or I think that was personally. Because
Isn't there an
as far as
Who's
cost,
running needle exchange now? It's
The-
still here.
Yeah, the
Family
Family
Health
Health
Center
Center has
still
it.
runs
Health center, okay.
So that was a situation that was a state-funded program that had been operated through Calhoun County.
Mhm.
And when it got to the point where we were distributing around 1 million syringes a month, and they were being left all over in public spaces, we said, there's got to be some changes. And eventually the state turned to the Family Health Center, who implemented some changes.
and
And so it's still going on, less publicity and
Right. And with, before the county would ended the needle exchange, there could have been, I think that there could have been physical accommodations made, more needle disposal sites, things like that. I felt that it was penny wise and pound foolish, really. And it was driven more by, these are bad people, and we're not gonna take care of them. That was my impression.
My last question, I know we're getting close to time. What do you see as, what should be the product of the Board of Health? How I've phrased it with others is, should it be programs? Should it be information? Where do you see, what should we produce?
I think that it has to be both education. People need to be educated on what the consequences, both the consequences of inaction and action, and what the importance of the different programs would be, whether it's advocating for vaccinations, whether it's advocating for mask use. This is the information. This is the best peer-reviewed information that we can give you. This is what works. This is what doesn't work, and you can make your mind up. But I think that that's one. And I think that, as I said, I think that funding programs is really important. Underfunding programs, it really makes a huge difference. When I was a medic, we changed our protocols every couple of years. And we did that based on what the best available science at that time was, whether it was for CPR, whether it was ACLS and the drug regimens that we used, whether it was using CPAP or lifting tarps so we didn't hurt patients picking them up, or back rafts so that they didn't get pressure sores from being on backboards for an hour. They need to be funded. As I said, one of the, if we're gonna look at government as being more like business, then you don't underfund it. People die. And unfortunately, I've seen it. And I'll tell you, just as a very quickly, one of the things that I saw repeatedly was people getting low or high in their diabetes, on their sugar levels. And the reason was the meters are free, but every strip costs between $1 and $2, and you test 5 times a day. This is, in one trip to the ER, there's $1,000 without even blinking. So we have to fund public health.
Before we end, I do want to thank you for your lifetime of donating blood. That's an important need everybody can contribute to.
And I would encourage people, I have over 200 either platelet or whole blood donations. And I was the first altruistic kidney donor in the state of Oregon. So, and I would encourage people to do that. There's 110,000 people on the kidney transplant list. And when I did the research, people live longer if they're a organ donor. So don't be afraid. Plus you get a 5-week vacation.
There's the motive.
There's always a bright side, right?
And it's not that big a deal. It really is not. So,
Well, our time is up, but if you have any questions, we let the other people ask us questions if you have a question.
I'm fine. I appreciate you giving me the time to out.
We
Thank you
appreciate
very
coming
much.
by.
We
Thank you.
appreciate your time
Okay.
and effort coming in.
Okay, thank you.
Thank you very much.
Have a good day.
You too.
No, I don't think during this interview stuff.
Okay. Just close that. Okay, well, we've met with all 3 of the applicants. We have more next week on the 20th at 10 o'clock in the morning instead of 8. And If anybody has any more, without anything else, we'll adjourn this meeting at, depending on what clock you look at, 9:01. Thank you.
Thank you.